It is late 2024, and so evolution of thinking always is evolving for me. And I want to talk to you in this case about how I manage hyperhidrosis, which is a fancy medical term for too much sweating. So in the past, when I first started my practice 20 years ago, mainly people were complaining of armpit sweating. And in that case, I was just doing Botox with great results. But I think we've really advanced the field now where I'm able to treat a very wide host of conditions for sweating, from hyperhidrosis of the face to armpit sweating, and even now hand and foot sweating, which I used to not be able to treat. So I'm going to talk about these three distinct types of sweating and how I manage it. And each of those three categories I manage quite differently. So for hyperhidrosis or sweating of the armpits, whether it's cosmetic or whether it's seriously a serious problem where you can't go out in public without having that area smell bad or drenched, I really recommend the Miradry process, Miradry. It really provides a durable, easy therapy where I think you can pay for the cost of Botox in a couple rounds, where you don't need to keep doing the Botox, because the Botox volume to place under the armpit is quite high and it gets quite expensive. So Miradry is something we do offer. I think it's a great way to manage that long term. And you don't have to be someone suffering with horrible sweating to have that fixed. So that is something that I would recommend over regular Botox for someone that can't afford it. They have some major event coming up. They just want a quick treatment to get that armpit sweating done, sure. Or they just absolutely don't want the Miradry. Absolutely, Botox still works well in the armpit. I just think, in my opinion, it's relatively outdated for the reasons I've enumerated. I want to talk next about facial sweating. So facial sweating is actually quite easily treatable, or head sweating. I've had some testimonials on my website you can take a look at. And this type of hyperhidrosis is very debilitating in terms of when you're doing public speaking, or you're out out at the gym, you're sweating so much it's crazy, or you are at work and you feel very embarrassed. Or some people I've done are they go dancing and they work up too much of a sweat where it looks really, their makeup runs, everything looks terrible. So in this case, I'm using a similar concentration of what I'm doing for meso Botox. You can look at those videos I've shot on that, which is a somewhat dilute Botox placed in little droplets over areas like the forehead, around the sides of the face, etc. And it really reduces sweating considerably without any adverse issues. In fact, there are some positive things too, is that the skin looks really good. In fact, you can treat areas of hyperhidrosis as well as the cheeks if you just want better texture as well, because it's the same dosing, in my opinion, in terms of what I'm doing. Applied slightly differently in the way I inject it, but it is, for all intents and purposes, the same thing. So that really works well, and I've noticed in my patients that do that, if they do that a few rounds every 3 to 6 months, eventually they go to 6 to 9 months, 9 to 12 months, 24 months, etc. The one thing I caution my patients in general is not to try to go 24, 36 months, even though it may be holding, is try not to go past a year over time, because I find that when you wait too long, I have to start the process over again, where you come in 3 to 6 months and then build it again. If you at least try not to go past a year, I think it really helps you not to need to start over and rebuild that from scratch. The last category, which is sweating in the hands and the feet, I've really invented a technique that currently right now is patent pending. It is a technique that I'm really proud of. It is a technique that's incredibly powerful, that does not require injecting actually into the palm of the hand or the foot. Because the traditional way, if you Google it, is to inject a lot of Botox into the palms of the hands and the feet. And this is the reason I've been always resistant to inject it, because it's incredibly painful and it potentially is short-lived. So I don't do that. I actually inject other points. I'm not going to talk about what they are because it's right now in the process of patenting. But I've had tremendous longevity success with this. I'm not saying it's have longevity after one round, but I can actually slow down the sweating within instantly to a day or two, and really quite effectively. So this is a method that I will share with you when you come into the office, but it's something that is completely different from, I'm very confident, anyone else on planet Earth doing for this. And again, it does not require injecting into the palms or into the soles of the feet. So this is something that I really am passionate about. So I have different methods to manage different types of hyperhidrosis or over excessive sweating, whether it's cosmetic or truly, truly dysfunctional. And I hope you come in and let me help you with those problems.